Hello guys, this is Dr. Haverkorn of River City Oral Surgery in San Antonio, Texas. Today is Sunday, March 23rd, 2020, and this is your coronavirus update for our practice. First off, we remain open. I am aware of Governor Abbott's executive order, and I'll deal with that in just a minute. The biggest news right now is that tomorrow I've been asked to be a guest on Jack Riccardi's radio show, the Jack Riccardi Show on our local radio station, KTSA, that's AM 550 or FM 107.1. You can also listen to it on the internet if you're not here in San Antonio. It's ktsa.com. I will be on from 5:20 p.m. Central Time to 6:15 p.m. Central Time. So please log in, tune in, check it out. We're going to be taking calls. You'll be able to call into the show. It's 210-599-5555. I've been reading a lot, researching a lot, and I'm prepared to answer questions and discuss coronavirus. Plus, as a surgeon, a big part of what we do is just infection control, keeping things sterile. So I've got plenty to say about those topics. Now, regarding Governor Abbott's executive order, today he said that all licensed medical practitioners and facilities in the state of Texas had to quit doing elective surgeries. That's not the exact wording. I'll put a link below for the exact wording. And exactly what an elective surgery is a little up in the air. I will tell you, in the dental world, for me, that's going to mean serious infection. It's going to mean pathology that is probably cancerous. So little calluses that we call fibromas in the mouth, I'm not going to be treating those. Little clogged salivary glands on the lips that we call mucoceles, I'm not going to be treating those. Things like that I won't be treating. And then it's also going to be trauma. Okay, so obviously if you've got lacerations to the face and you've got broken bones of the face, I'll be treating that kind of stuff. Okay, serious dental infections means infections that are likely to cause sepsis, which means basically that the infection's affecting your entire body. Or it means that the infection is likely to compromise your airway because the swelling is moving down into your neck, making it hard to breathe. Okay, the most severe form of that is called Ludwig's angina. So I will treat patients and conditions which, in my professional opinion, I think could lead to that. You should know that I have a lot of experience dealing with infections. For the last several years, I've been one of the few local oral surgeons taking call in our emergency rooms, and in the last few months, I've been the only local private practice oral surgeon taking call in our emergency rooms. We routinely, when we're on call in San Antonio, receive patients from Austin, Corpus Christi, Del Rio, and surrounding cities because there aren't oral surgeons on call in those cities. Victoria as well. Houston has sent me patients. Conroe has sent me patients. Tyler, Texas, which, if you don't know your Texas geography, is way up in the northeast corner, that'd be this side for you guys, has tried to send me patients. So I've dealt with a lot of those. I've dealt with serious emergencies where patients literally had a few minutes to get their airway established. Because I've seen that, and because I've dealt with lesser infections, I have a pretty good idea about when something's going to be serious and when it's not. Our first choice is going to be medical therapy. That means using antibiotics and pills to treat things. Our second choice is going to be surgery. Certain cases are going to be only surgery, though, if, in my opinion, it looks like it's serious enough to need that. And then if antibiotics run low, which I have not heard any rumors about that, don't freak out, but if antibiotic supplies get low or we're asked to conserve antibiotics, then we're going to quit using antibiotics to treat dental problems and we're going to just pull out teeth. So if you need something, you can still call the office and we will take care of you. We're not doing routine consults. We're not putting in implants in a place where you've been missing a tooth for years. We're not taking care of joint pain. We're not doing reconstructive facial surgery and other aesthetic and cosmetic things, but we are here to serve the community. We are here to serve emergencies. We will be available. The last thing I want to talk about is just the YouTube channel. I crossed 5,000 subscribers this weekend because everybody's stuck at home and you have to watch me because there's nothing else cool to see. You got to the end of the internet. You wanted to know where the end of the internet was, you found it. So we crossed 5,000 subscribers. I'm super excited about that. People may be wondering, well, why aren't there new videos? Why haven't you had a good pus video since January? The answer is that I haven't been taking call since January. In February, a mentor of mine had significant surgery, and I had to travel out of state for that, and didn't want to risk being stuck in San Antonio with patients, so I didn't take call. Here in March, I've been working with the hospital to figure that out, but soon I expect to be back on call. For now, I'm going to edit some videos that I do have that haven't been posted. If I get called to deal with something corona related, I'll try to make a video of that if possible. If we can, we'll take videos in the office too. So, we want to do all of that for you. The last thing I want to talk about is just what are we doing at River City? We have lots of PPE, and I've got more coming in tomorrow. I may even try to buy some from some of the offices in town that have closed down. I've got lots of bleach. If you go to the CDC's website, they talk about using bleach to disinfect. So obviously countertops like this, cabinets, things that are hardy and can stand up to bleach, we can do that way, and that's going to be the most cost-effective and longest lasting way to do it. I only need about half an ounce in this container, and the rest can be water in order to meet the CDC criteria for a good disinfecting solution. So this thing's got, 96 fluid ounces, so that's 192 bottles out of this. We're good to go for a while. We've also got your regular stuff. We've got your Walmart knockoff Lysol spray. We've got wipes. We've got PPE. Like I said, more coming. So we're good to go on all of that. One other thing I'll point out, we're going to start taking temperatures on more patients. I bought this at Lowe's last week. It's an infrared thermometer. It's the ones that you can use to just measure the temperature of an air conditioning duct or your engine or something without touching it. And I really thought this was going to be great. I'd be able to just shoot it at patients' foreheads and get a temperature without having to touch the patient and worry about wiping this down. Unfortunately, these industrial thermometers are not calibrated for human skin correctly, and they give us a pretty wide variation. At first I thought, well, if they're always 10 degrees off, I can add or subtract 10 degrees or whatever, but it turns out just testing this on staff versus your normal ear thermometer, I don't see that there's a standard deviation that I can always count on. So, while this was a good idea, it's not working for me. Now, I know that there are medical variations of this that are made to use on human skin, but as I've been researching this, I also see that those have a lot of limitations. So, for right now, we're going to stick with the ear thermometer. It's got a disposable cover. We have stuff to clean it off. If I run out of the ear covers for these things, then I may go to just a temporal scan, which I also have, but we are set in all of these areas. So tune in tomorrow to Jack Riccardi's show, AM 550, FM 107.1 here in San Antonio. It's going to be at 5:20 p.m. If you can't hear the station, then log on to ktsa.com and give us a listen. Be safe, practice your social distancing. Stand 6 feet away. I'm 6'3". This is 6 feet away, okay? In the stores, use your shopping cart behind you or in front of you if you can't keep people off of you. It's amazing to me how people just want to get up on you in the stores. I would say walk down the right side of the aisle so that we're not bumping into each other in the store. It drives me nuts. We're in America. We walk on the right. This isn't England. We don't walk on the left, okay? So just go down the right side and we won't bump into each other. If you need something on the shelf, wait till the person that's right there gets out of the way, okay? Or it's fine. You can wait a second. And then also, I'm not using self-checkout. I'm going through the cashier lines even if I have to wait. The reason being that only the cashier is touching stuff there. I don't have to touch much of anything. I don't have my pen in my pocket, but when I use the keypad, I use my pen to do that. So I would just recommend that you avoid self-checkout if possible. And of course, use curbside if you can, but obviously with a lot of different companies, the curbside's kind of lagging and you're never sure if you're gonna get what you want, all that kind of stuff. So I understand that you may not be using curbside. Also, can we please stop bringing more than one person into the store? Good grief, okay? I see families coming in or groups of friends coming in. One person per household would be a great idea. So be safe. I'll see you on the radio. Well, I'll talk to you on the radio tomorrow. Have a good night. Thank you.